Kenny, how are you? Good to see you.
It's great to see you, my friend.
How have you been?
I have been above ground. I like that part. My father-in-law, who is closing in on 90, keeps telling me that I shouldn't get old, and I keep reminding him that the alternative isn't very good. So I'm proceeding, and my wife won't let me retire because she doesn't want me at home that much. So here I am.
Are you close enough to retire?
Oh, I'm Medicare eligible.
Oh shit, I didn't realize that.
Yeah,
Known you
as
for way
of
too
a couple
long.
of months ago, I turned Medicare eligible. But I'm going to be doing this for a while.
That was the applause.
I'm just thinking I'm on Howard Stern's show.
Yeah. So we are going to talk a little bit about AI regulations, and we're going to talk about how they apply in healthcare. But before we get started, you want to tell people about yourself?
Sure. I'm a healthcare lawyer by trade and training. I practiced law for 30 years, representing managed care entities, hospitals, doctors, etc. In the courtroom. I didn't do transactional work. I didn't do that. I was a trial lawyer. And I spent about half of my time keeping doctors and hospitals out of trouble, and the other time trying to make sure they didn't get paid for what they did, because I represented both sides of the industry. After 30 years, I decided I'd go do something different. So I became a risk and risk financing consultant. My background before I went to law school was in economics, so that worked out pretty well. A lot of what I did involved insurance and insurance coverage issues and things like that. So it was a natural changeover. And I created a managed care industry group at my former employer and built that up significantly. And about a year and a half ago, I left there and went to Alliant Insurance Services to create and then run the managed care industry group. So if you see that MCIG, that's what it stands for, Managed Care Industry Group. And it's a dedicated, focused group of experts in the field for risk identification, risk quantification, mitigation, and finance for principally the managed care industry. But I refer to the managed care industry as the island of misfit toys. If you're a big, I'm Jewish, but Rudolph was still a favorite of mine. So the island of misfit toys is what I refer to it as, because all of the holes around and all of the pegs are square when it comes to this industry. And the industry has changed so much in the last 40 years since I've been working in it that it's unrecognizable now. It includes traditional managed care plans like Blue Cross Blue Shield of pick a state. And then it includes conglomerates like UHG. It includes entities that are multiple plans like Anthem or Elevance, as they're now known. It includes companies that have large PBMs like Cigna and ESI, or CVS, Caremark, Aetna. It also includes the rest of the alphabet soup, whether it's a PBM, pharmacy benefit management entities, third-party administrators, management service organizations, accountable care organizations, risk-based reimbursement entities on the payer or provider side. Vision, dental, pet insurance is considered managed care. So it involves a lot, and I lead the group of people that provide the services and products that we offer through Alliant Managed Care Industry Group to that segment.
Now, Kenny, one of the things we're going to talk about is the AI portion of that. How much has AI affected what you guys are doing? It feels like risk is risk. How does AI change any of that?
Well, AI is very, very important as it gets better. Now, remember, AI is neither artificial nor intelligence. It is a computer program where the computer has gotten better and better and better and faster and faster and faster, and the programming has gotten better and better and better and more diverse, so that you can feed enough data into the system, it can run it fast enough according to the algorithm that you've put into it and pop out an answer, or a whether or not it's recording your voice as a scribe program would do for a medical conference or a patient visit. It can do procurement. The example I use most of the time is buying toilet paper. If you're HCA and you've got 500 different facilities nationwide, toilet paper is something you have to have. But toilet paper takes a lot of room. So if you're going to store mass amounts of toilet paper, you have to pay for the space to store it. So you don't want enough for a year on hand at any given time. And as we saw during COVID, sometimes it can be hard to come by. It also, the price changes. Logistics and shipping gets different. Your census goes up and down.
Kenny, I've lost you in the analogy. Where are we in the analogy right now?
The analogy is that you can take AI and structure your procurement to where you have what you need, where you need it, and the most effective and cost-efficient way of doing it. Now, take that same concept, because healthcare uses procurement, obviously, and string it to supply of the building blocks or things that go into making medication for the pharma industry. Mm-hmm. Your side of the house.
Yeah.
Assimilating information related to clinical trials.
Yep.
Diagnostic review of diagnostic studies, population health, et cetera, all the way down to, on the managed care side of things, actuarially determining, what your expenses are going to be next year for GLP-1s. Mm-hmm. It can be used in a very, very wide array of issues. It is in its infancy with some of those, and it is much more advanced on things related to large language chatbot kind of stuff, things that you would use for call centers, employee or member experience apps, programs, those kind of things, or procurement issues, supply chain, things like that. I wouldn't want a computer treating me now for, respiratory infections, but give it some time and it will probably be as effective, if not more effective, than most physicians are.
That's an interesting statement, because I was actually thinking about how AI is affecting the actual provision of payment and risk deferment, if you will. What you're talking about is, go ahead.
So if you wanted to go that way, then billing and coding. Every provider out there, every pharmacy out there, every PBM, and every payer of any kind, whether or not it's a government payer or a commercial payer, self-funded health plans, et cetera, uses billing and coding.
Sure.
So AI can be very effective. It can also be very nefarious, depending upon how you program it, to determine whether or not what is being provided and what is being billed for is what ought to be billed for, and whether or not that's a covered service that ought to be paid, and at what rate.
But that's been happening for decades. How has AI changed that risk, if you will?
It makes it much, much more efficient. The number of dollars that get spent in billing and coding between the actual straight administration of doing it using AI is like the difference between mailing copies of bills from a physician's office to Aetna as getting electronic billing. So now we've leapt up another level that's exponential, so that the process can go like that. Now time is money. So there are any number of startup AI entities out there that are focused on billing and coding. So their concept of being, I want to make sure that you can get your bills done as effective and efficient as possible with as completeness as they can, so that they go to the payer, they go through their AI algorithmic processes and pop back a check to you with the least amount of headache, with the least amount of cost, with the fastest reimbursement. Now, one claim at a time, it doesn't matter. You know, hundreds of thousands of claims, millions of claims, billions of claims, depending upon what you're looking at, it matters a lot.
That's really interesting. I hadn't thought of it that way. So thank you for helping. Now, here's my question with that. A lot of PBMs, I can speak to PBMs for a large portion of this. A lot of PBMs are set up to actually add viscosity, if you will. Example, using prior authorization. The argument is that, do you really need this medication, or can you do with something cheaper or something in a different line, if you will? And I had an absolute nightmare dealing with it earlier this year. Having said that, the fact is that if AI makes things faster, how does that work in the context of you want things to be slower?
Nobody wants things to be slower.
Interesting.
The fact that things get slowed down is usually a function of misunderstandings of members with regard to what their benefits are.
No, prior auth is by definition trying to slow down the process to go.
No, prior authorization by definition is getting authorization, but to make sure that you meet the criteria for the benefit to be provided. It can be done like that. If
theoretically,
there are very, very, very few things that require prior authorization that would require anything long and drawn out. Most of the time, prior authorization is a matter of getting the right information to the right people.
No, but the existence of prior authorization is, yes, it could be about, oh, I want to check the plan benefits and making sure it lines up. But it's also to go, well, I could just pay for it as a claims payer, but I'm going to slow down that process because I want you to prove to me that it's necessary, i.e., slow down the process.
Well, I mean, it's not designed to slow down the process. It's
I thought it was.
It's designed to make sure that the benefit is owed.
Interesting.
Let's stay on your side.
Sure.
Pharmacy tiering.
Yeah.
Whether it's Part D under Medicare Advantage, or whether or not it's a self-funded health plan, or whether it's a fully insured program with drugs built in, you're going to have a formulary that's got tiering in it.
Sure.
All right. So in certain cases, you know, the requirements are that in order to have drug A that your doctor just saw because I don't want to get into how much pharmacology doctors know or don't know, but I mean, you know, they saw the commercial too, and you saw it. And so you're out there trying to get your drug. And there are other drugs, whether they are biosimilars, whether they are generics, whether they are a different drug completely that may be just as efficacious as this drug, but they're a lot cheaper. Or your plan covers them for whatever reason. We don't have time to get into the whole, you know, how that process happens or why, you know, or who benefits from it. But there is a contract that says we pay for this if you meet these criteria. Now, if the claim comes in or the request comes in with all of the supporting documentation, then the prior authorization goes through very quickly.
See, I've had problems with that. I'm talking personal, and again, it's hard to argue over someone's personal experience, so I get that part. But my experience has been that it is set up to. Have you heard of the term nudging?
Yeah.
Okay, cool. You from a marketing standpoint, you know what nudging is, right?
Yeah. Well, I mean,
Okay.
it's also the reason why you have to go through 19 different, chatbots on a
Right.
telephone line before you ever get to a human, because most people give up before then.
And I think that's exactly the point. I think a lot of us see prior auth is exactly that. Like, hopefully you'll
It certainly can appear that way.
Okay.
And I won't suggest that it's never been used for that.
Sure.
I will suggest that that's not the reason why they have it. And it's not the reason why most companies use it, but it certainly can appear that way to a member or a patient, if not the healthcare provider as well.
So Helen pointed this out. Some person has to input the proper codes to begin with. A friend
Yep.
recovers several $100,000 for a surgeon friend because his previous biller coded things incorrectly. So while
Yep.
AI can help, it can only go as far as the person inputting the codes. So the question then becomes, is AI
But at one point in time, soon, very soon, AI can put the codes. AI can review the medical records. AI can go through the medical records with a whole data set of similar medical records, pick out the codes that are necessary to put in, add all of the other information that's supposed to be there, make the claim, ship the claim.
Who's guilty in case of fraudulent billing in that scenario?
Here's the interesting thing. Legislatures are slow.
Mm-hmm.
Regulators are slower. Courts are slower still. Now, there's nothing wrong with that. It's just the way that it happens, because courts, the way they operate, other things have to happen before you get to what the courts do and don't do. But fraud is an intent, whether or not it's civil fraud or criminal fraud. You either have to have reckless disregard or an intent to be fraudulent, to lie.
Negligence doesn't count?
No, not for fraud.
Okay. There might be other issues. Okay.
Computers don't have intent.
Yes, but they're doing it on your behalf, so they're your agent at that point. So
I didn't lie. Let's take the FCA it's a great example, because the False Claims Act has billing and coding, right?
Yep.
What we're talking about. Two, there are civil enforcement and there are criminal enforcement parts to it. The civil side of FCA is, I just billed you, the government, or the government as a secondary payor, for something that I wasn't entitled to bill you for, and therefore I violated the statute. Now, I can also do that intentionally, and they can come after me and throw me in jail for it.
Yep.
But if I'm using AI, my defense lawyer is going to go, well, you can't throw him in jail. He didn't do it.
I thought agents did it. Yeah, the computer did it, but you should have, in your role as administrator, evaluated.
Crime. You have to prove that I had the intent to defraud.
But the intent to defraud is broadly read.
Oh, that depends on what the court's going to do. I don't know what the courts are going to do. We haven't gotten there yet. So that's the point. I mean, I don't know. So here's another thing with regard to AI. So right now we have robotic surgery, right? And I mean, a doctor in one location using a joystick or whatever, operating equipment somewhere else, whether it's the next room or 4 states over.
Sure.
Pretty soon we will have AI systems running surgical procedures or diagnostic procedures or interventional procedures. Now, they may be much better than doctors doing it. I don't know. We'll get there.
Mm-hmm.
But something goes wrong and you're the patient, you're on the table, something goes wrong, you want to sue somebody. You can't sue anybody for medical malpractice.
Why?
Who has a medical license? The machine doesn't have a medical license. The computer program doesn't have a medical license. The computer tech doesn't have a medical license.
I'm going to call you out. If you're engaged in the practice of medicine, You should have.
If you're engaged in the practice of medicine, where is there a person with a medical license in that loop?
So one of two choices has to be made. Either you're engaged in the practice of medicine or you're in the unauthorized practice of medicine. If a device is operating within me and is curing, treating, preventing, diagnosing a disease state, it is engaged in the practice of medicine.
No,
therefore,
it's a device. It can't wait. Medical malpractice didn't exist at common law. So medical malpractice statutes are state statutes that define what medical malpractice is. You are correct. In order to be sued as a defendant in a medical malpractice case, you either have to be practicing medicine or with a license, or you have to be responsible for someone who is.
Right.
Like a hospital.
Right.
But I mean, hospitals can't be sued for med mal either. They can be sued for vicarious liability for another, whether they're an employee or an agent. But in my scenario, you have a machine operating on you based upon a computer AI program that is being run by a technician and was created by a computer software. Not one single person in that loop has a medical license.
So there are two different answers to that, two different versions of the answer to that. So one is we've got Waymo on the streets in San Francisco. It's about to open up in Philadelphia. There's always a person who is responsible for how the car is driving. That car hits someone. No one gets to go, oh, there was no one driving, no one's responsible. No, someone got hit. They have to be compensated.
Different concept. Not being able to be sued for medical malpractice doesn't mean you can't be sued for a cyber technology incident,
design defect,
and negligence with regard to design of the software, product's liability with regard to the machine itself, but it just can't be med mal.
Okay.
Now, where does that matter?
I'm not sure I agree with you, but I'll give you that point for a second. But
give me that point. And where does that matter? It matters because all those tort reform laws that are out there, they only apply to med mal.
Interesting.
They don't apply to products.
I'm not going to concede that point, but I'm going to move past that point. It's an interesting point to get into.
That's an issue that we're going to go forward with regard to AI, which actually brings me back to the very beginning, which is the regulatory piece of this.
Please.
Which is we're going to get in the not too distant future to places where guardrails are going to be required.
Yes.
Now, the Trump administration has made a choice. It's a legitimate choice, whether you believe it or not, or whether you agree with it or not. It is a legitimate government policy choice to follow the field of dreams. Build it, they will come.
Okay.
Get the infrastructure up and running, get the data centers up and running, wide open, Wild West development of the capabilities of AI. Build it, and we'll because we want to be first. We want to be in charge. We want to run it like we did the internet to start with.
Sure.
I mean, we want to be in charge, and there's a lot of reasons for that.
Sure.
And we know that government regulation slows all that down.
Sure.
We know that our biggest competitor in this spot is China, and they're not going to have any regulations at all. Yeah. So. What do? You allow the EU has already started regulating. Nothing related to AI is ever coming out of the EU.
But the EU is kind of given up as well because the EU there's a whole discussion there. Sorry, I'll just stop there.
Right. So I mean, that's the purpose. So the original in the last 3 administrations, 4. Let's go back to pre-Trump last time. There have only been 12 or 13 laws, regulations, executive orders, or sets of guidelines that have come out that regulate anything related to AI. And half of those were undoing what some of the rest of them had done.
Okay. What's the point you're making?
The point is the federal government isn't regulating AI. and won't regulate AI
Well,
for a number of years.
Well, I'm gonna disagree with that. I think I agree with your sentiment, but not the way you phrased it.
Okay.
Your sentiment is that the federal government will minimally regulate AI. However, they don't want state governments to regulate AI.
Well, they don't. Correct. But I mean, they don't want
Okay.
state governments to regulate AI because they don't want any regulation of AI.
No, but by definition, you can't just go, I won't have regulation, you can't have regulations.
Sure, you can. If the
Federal preemption required.
It's
Federal
a federal
preemption
supremacy
required.
violation.
Sure, but you
What?
need to have something to be supreme with, i.e.
Yes, you could. An absence of something, I'm not going to let you do it.
I'm not sure. I don't think that could qualify.
I think it does. But we won't argue that. That's the course that they've charted.
Sure.
And they don't want states to do it.
Sure,
now,
I agree with that.
The one big beautiful bill had that provision in it that didn't pass. The executive order that just got signed a couple of days ago is not law. It's just directing the agencies that he has control over to do certain things to try to limit states. A lot of states are following, in the footsteps. And then there are a few that are, California, the one you could normal, California, New York, Illinois, Colorado, those. But most of those regulations that have come out, even assuming that they get passed through court muster, which, most all of it is related to either privacy or very limited use restrictions. Like Illinois passed a regulation or a law that says that you cannot use AI for
the employment decisions. Is that the one?
Behavior health.
Oh, behavioral.
It was behavioral health, visits. So I can't have I can't think that I'm calling to speak digitally to a behavioral health professional and have it be a computer.
Right.
I mean, there's a case right now in criminal court, and one state,
the OpenAI one you're talking about.
Yeah, where the guy was paranoid schizophrenic, and he had developed a relationship with the chatbot, and the chatbot was there to support him and basically convinced him that his mother and his aunt were out to get him, and he killed him.
I saw the killed himself. I didn't realize the mom was trying to get him was the prelim to that.
So I mean, the chatbot basically convinced him to go kill his mother and his aunt or his grandmother or whoever it was, and that's why they said that. But that's why wouldn't you do that? And they're not trying to limit infrastructure limitations like on zoning. Like if you don't want a huge data center that draws a gajillion megawatts of power in your backyard, they're not saying you can't, restrict that kind of stuff. They're just saying we don't want you to start significantly limiting the uses available and making it very difficult to implement uses for AI, because that will slow down the development of AI, and that's what we don't want to happen. So there are very few. Now that leads you to this conclusion, which is entities themselves are going to have significant compliance and governance programs for their own entities to limit things like shadow AI, which is the new word for employees coming in and using AI that they're not supposed to. One of the biggest concerns out there.
Okay.
Yeah. So one of the biggest concerns now is the AI-enabled glasses.
Yeah.
So you don't wear glasses. I wear glasses. I can go get the Meta or a Ray-Ban beautiful Meta-enabled, AI glasses, walk them into something and violate 15 different state and federal statutes like that.
Yep.
Why?
Yep.
Because, HIPAA, just because you're using AI doesn't mean all the rest of the laws that are out there cease to exist. There are still limitations on appropriate use and disclosure and protection of patient identifiable information and personal health information and financial information. And if somebody's walking in with AI-enabled glasses and using them at all, you've just violated HIPAA and a whole bunch of other statutes too.
Kenny, my friend, we have not even touched the surface of AI. Like, I don't even think we even grazed it, and we're at 30 minutes. So we're gonna have to call it. However, I have 4 different completely unrelated topics I wanted to get to that we did not. So we're gonna have to just have you over again. Before we go, tell people about Alliant. Tell me why it is incredible, but outside the fact that you are involved, and I've always been a big fan of Kenny. And how do they reach you if they have questions?
Well, you can reach me on LinkedIn at Kenneth White. It's Alliant Insurance Services. I'm the Senior Vice President and Director of the Managed Care Industry Group. I also am the founder and chair of the Managed Care Institute for the ABA Health Law section. I speak a lot, but I mean, Alliant is an insurance brokerage and consulting entity. We're the 4th or 5th largest company in the U.S. and one of the largest in the world, and the largest privately held. We are the largest privately held entity in the space. We have a very, very large and robust healthcare division external to our employee benefits group. And my focus and my team's focus is on the non-hospital, non-doctor side of healthcare.
Fascinating.
I was going to tell him, I'm just going to message my daughter's school that they're not allowed. Yeah, because it would be cheating. It would be cheating.
I thought that was interesting. And Kenny, the last question was they reach out to you on LinkedIn. Is that what you said?
That's the easiest way. My email address at work is very easy. It's just kenny.white@alliant.com. But you can find me on LinkedIn. I'm prolific there.
They allow you to say Kenny on your email as opposed to Kenneth?
Yeah. Interesting.
Yeah.
But you know me, you've known me for a long time. That's what I go by. Kenny Rogers, Kenny Stabler, lots of good Kennys out there.
Love it. Kenny, thank you again. Great having you on. I genuinely have more topics to get to you on. So we got to have you.
Let's do it.
Yeah, you tell me when you're free. You know how to reach me. We're gonna schedule this.
I gotta get to Philly.
That's it'd always be good to have you in Philly. But I'm gonna end this. People, stay tuned. We're gonna have Kenny back, and it's gonna be a great conversation. Helen, thank you so much for participating. You're mensch, as they put it. So thank you.